Hello, my name is Clara Maveglia and I founded the Cultural Entrepreneurship Institute in Berlin. Today I am in Manchester and Michelle Harvie is my guest. She's best known for the 2-day diet and her research on breast cancer. Welcome to our community, Dr. Harvie. Hello, Michelle. Nice that we are here finally and meet personally. And I would like to ask you if you could introduce yourself.
Yeah, so it's great that you've come. My name's Dr. Michelle Harvie. I'm a research dietitian here at the Genesis Prevention Centre, where we work on trying to look at optimum diets for health and reducing risk of breast cancer.
Can you tell us something more about your training? Because I saw you are a dietitian, but you also have a PhD. This is really interdisciplinarity.
Yeah, so I think I can remember I trained as a dietitian about 25 years ago. I qualified as a dietitian and worked in a hospital helping people with gut problems, intensive care, and realised that there actually wasn't much evidence for a lot of the diets we were advising people to do, because a lot of dietitians don't do research. So we do things because we've always done them. So I got interested in asking questions, and then an opportunity to do a PhD in nutrition and cancer came up with Professor Howell, who I still work with, and that was 20 years ago I started that. I've been working with Professor Howell ever since in research and still realising there's a lot that we need to know.
Still now?
Oh yes, the more you know, the more you realise you need to.
But what influenced you in your life actually? There are people that would continue to do, as you said, what you have always done, but you wanted more. Why?
Yeah, I guess I've always asked questions of why things happen and always wanted to know a bit more. And I've always been very interested in nutrition and food because it's fundamental. It does influence, you know, how we are, our health, influences so many diseases, probably how long we live, how healthy we are. And there are lots of things that we don't know about it. So this was, you know, a great opportunity to be able to try and look into some of those questions really. And food, if we can get people's food right, we can help so many people be healthier. It's something that affects everybody.
Okay, yeah, but do you have a vision or already, or had you a vision already, or you were just following, you know, a path or your intuition? How did you combine this?
I guess I've always been somebody who, I've never really had a great plan, because I think sometimes if you plan your life out exactly, then things don't always go right, but you look for opportunities and you see doors that might be opening, and if you sort of pursue that further, then if you go through those doors, then it opens other doors. And I think it's being able to spot a good opportunity and pursue it, and you know, work hard at something, and you'll get the rewards really.
Yeah. Yeah, and you are so far. So your research has had and has a huge impact. How did you come to that? How did you discover this diet, this special diet, this 2-day diet?
Yeah, so the 2-day diet is something that we've been working on for the last 10 years really. So it took a while to get there. So I guess my work in diet and cancer started off by trying to look at the links between weight and risk of breast cancer. And about 10 years ago, we did some groundbreaking research which actually showed that if women could reduce their weight by about 5 or 10%, that would dramatically reduce their risk of breast cancer by, depending on your age, by 25 or 40%, a big reduction. But of course, I remember at the time my colleague Professor Howell, who I've been working with for the last 20 years, was jumping around the office because he's very enthusiastic, saying, "This is great, you know, we've got the solution." And I thought, well, it tells us what we need to be trying to do to help people, but the problem is that most people find it very difficult to lose weight, And, you know, most diets typically only work in about sort of 2 or 4 out of 10 people that try them, because people find things hard to keep to. So I started trying to think about how we might do things differently, and that we needed to find a new way, a new paradigm of dieting, really, to try and help people find something that was easier to follow, but also perhaps something that might be more effective, might have a better effect biologically and on, you know, at a cellular level, to try and reduce particularly cancer risk. And while I was trying to think of how we might go about that, there were some animal studies which came out of America, where they had looked at either animals that were calorie restricted across the whole week, or ones that were just calorie restricted for short periods and then allowed to eat normally. And lo and behold, the animals that were just calorie restricted for some of the time and not all of the time actually seemed to, if anything, get less cancers than the animals who were calorie restricted on a daily basis. So I kind of thought, well, let's give it a go. It might be something, if we just ask people to focus on dieting for 2 days a week rather than 7, which is a standard approach, it might be easier to follow, and it might actually have better effects on metabolism and health. So that's when we started off trying to look at the 2-day diet. As I say, about 10 years ago, we started our research on this.
Already,
yeah.
But if we stay just a little longer on the weight, before we go on the details of your very effective diet, why is weight so important? Why should we care about weight? So, even if we are not ill or... Yeah,
so a lot of people don't realise, but a lot of the health problems that we face in the Western world, things like cancer, diabetes, heart disease, and also dementia, are very strongly linked, not necessarily to what you ultimately weigh, but to actually gaining weight as you get older. There's probably something about how the body behaves when it's in a state of being overfed, when all your cells are happily dividing, and that's when things can go wrong in the cells, which of course is the first step in towards getting different diseases. So being overfed is bad news, and of course as adults we spend a lot of our time being overfed, and a lot of people spend very little time when they're not eating. In fact, you know, breakfast really for a lot of people isn't really breaking a fast, because they've maybe been up into the small hours of the morning on computers, eating, snacking and things. So we think that weight is really, obviously having too much body fat can be bad for health for a number of reasons. It increases levels of hormones and inflammation in the body, but also it's probably a very good measure of how much of your life you've spent in an overfed state compared to an underfed state, and we think that balance is really important for health. And most people gain weight when they get older. That's the norm, isn't it?
Yeah, but actually there is also this problem with children obesity.
Yes.
How can we stop that?
Yeah, so I guess at the moment people like myself and my colleagues, we've been studying adults who tended to be quite thin and healthy as children and young adults, and they're getting poor health now because they've gained weight as they've got older. But of course we actually don't know what's going to happen to the next generation. You know, the children now that are already overweight or obese at a very young age, and in adolescence and as young adults. I mean, clearly there's a problem already with things like diabetes and heart disease risk. We're not quite sure how it's going to manifest itself in cancer. And the question is, yes, how can we help prevent children being overweight? I guess a lot of it is going to be, you certainly wouldn't advocate things like the 2-day diet for children, but if children maintain a level of physical activity and follow, you know, the guidelines of a healthy diet, and cutting out all the very high energy dense foods, sugary foods, high fat foods, then their weight should be pretty well controlled. So you probably wouldn't be looking at putting them on diets as such, but just really trying to encourage an overall healthy lifestyle, which I guess may mean some, parents having a role, schools having a role, but probably also the food companies stopping advertising and promoting unhealthy foods to our children. I don't know what's happening in other European countries, but there's quite a lot of talk in the UK to try and legislate to stop unhealthy foods being advertised quite so aggressively to young people. But I think parents need to take some control as well. The number of adults that we see who we're trying to get onto a healthy lifestyle, and they often say, oh, but I have to have sweets and biscuits and fizzy drinks in the house because of my children. They want it, and I do say to them, children do not have to have those foods, So we're not expecting children or even adults to live as vegans or have a 100% healthy diet. It's what I say to the patients that come into our trials that we see here in the clinic. I don't care. I care about what you eat sort of 80 or 90% of the time. I don't care about those odd sort of treat things. It's a balance, and that's it. Nutrition is a balance, and I think people get very caught up in saying that this food is bad or this food is good, and it's the overall pattern that you need to get right.
Yeah, this is also something happening that you have always every season, a food that is bad or something new coming on. For example, nowadays they say pasta and bread are bad, or milk is bad, or of course sugar and alcohol is always like that. But what you say about that? So shall you follow all this, or should you, or just a little of everything? What would you suggest?
So I think nutritionists and dietitians have been very guilty of putting everyone down that road of trying to think about whether foods are good or bad, and quite often that's how things were traditionally researched. You looked at people's diets and said, okay, do they have a lot of saturated fat, or do they have a lot of fruit and vegetables, and is that linked to poor or good health? But that is such a simplification, and we know that probably, I don't know what's happening in other countries, but in the UK there's been this big sort of backlash about how saturated fat may not actually be that bad. So that's the fat that you find in dairy, high-fat dairy foods or meats. And I think the reason that it perhaps looks unhealthy quite often in the diet is because it stops people having the healthy fats that you actually need. So that's your fish oils and the olive oil, monounsaturated type fats. So it's not that saturated fat is necessarily bad, it's because if you have a lot of that, you're not having the good stuff. And so, it's an overall balance of diet that we're looking at. And now people are trying to, and what we've been doing as well, is promoting a whole package of a diet. So generally we're talking about a Mediterranean diet, which of course is the traditional diet of countries like Italy and Spain and Greece, which unfortunately a lot of people in those countries are moving away from, and they're adopting a more westernized diet, which is higher in sugar and higher in animal fat and alcohol, and lower in fibre. So things like pasta and bread, for example, are often demonised. But really what we should be doing is getting people to limit things like white, refined bread or white pasta, white bread, but actually having more of the bread with fibre in. Those are the ones that are good for us. So it's not a case of all bread is bad or all pasta is bad. You've got to pick the right.
Okay, so
ones.
pizza is still allowed.
Yeah,
maybe whole wheat pizza.
Yes, yeah.
Something like that, yeah. And about milk, what would you say? It's really now very quickly, so lactose frei, you say in German, or avoid milk.
Yeah, no, again, there's very little good evidence to support cutting milk out of diets. I mean, some dairy foods are very high in the animal fats, which are maybe not good. So things like cream and too much cheese, for example. But really, dairy foods are part of an overall healthy diet, particularly low-fat dairy foods. And there's a lot of concern about cancer risk in dairy foods because things like milk do contain hormones and growth factors, which people get very worried that they're going to stimulate cancer growth, but they have such a small impact on the levels of hormones and growth factors that are in our bodies naturally. They're irrelevant really. And in fact, when you study populations and look at dairy intake and health, generally, particularly intake of low-fat dairy foods is linked to sort of good health, lower cancer risk, certainly good bone health, and probably low blood pressure and heart disease risk. So we certainly advocate low-fat dairy foods as part of an overall healthy diet.
Yeah, thank you for this information, so that we are now a little calmer in this sense. But while you were talking, I was thinking about recently I've heard that in Finland they want to increase the amount of time that the children spend playing.
Yes.
Because they say this is the most important for every part of the body and the mind that children play, just especially outside in the nature.
Yes.
And then I thought the very nice part, in my opinion, of your diet, of your system, is that there are no really strict rules. Actually, it is in 2 sentences, 2 days a week you should eat less.
Yes.
And of course the other 5 days not exaggerate on the other hand, so that so that is something that you can play with too. It's something that you can do without feeling that you have to do something like a punishment or not have fun in life anymore. And this is something I enjoy very much, this idea that is something good for you, but it's not really a kind of penalty, or you don't feel like that. So,
and that's the point. Things won't work if a diet or a lifestyle change or a physical activity program will only work if somebody enjoys it, has the time to do it, and gets around to do it, and actually gets some positive feedback from it, because we're trying to get people to follow a healthy lifestyle, be a healthy weight, exercise, because we think it's going to reduce their risk of getting a disease at some point in the future. But we're programmed to be quite simple, and we respond to feedback that our bodies give us on a day-to-day basis. So if you're doing a diet that gives you a headache, makes you feel hungry, makes you feel like you can't concentrate, you can't go out with your friends, you can't put it into your life, you're just not going to do it. It's not that, that the benefits are not going to outweigh the pain that you're suffering on a daily basis. So I guess the great thing and the feedback that people give me about the diet is, first of all, they get around to trying to do it, because it's only 2 days out of the, I was going to say 5, 2 days out of the 7 that they have to really try and do it, and then it's done. So it's quite, people can motivate themselves to get around to doing it, and they find it's not that bad. And our diet is designed so it's quite high in protein and low in carbohydrates. So it's designed so people shouldn't feel hungry, because any diet where you feel hungry is not going to be sustainable. That's the dieter's enemy, being hungry, because then people will break it and it won't work. So and people often feel quite good on those days. They get, like, I guess a lot of people get a positive feedback when they exercise. They get they get a sort of buzz from exercising, and quite often people feel quite good when they've followed a healthy diet for a couple of days. They feel quite cleansed, and so every week they're quite happy to revisit that and get that sort of positive feedback. And then of course they can see their weight going down, and that's what really buys people.
What you also write in your book is that in doing this or doing so, you burn the fat, and the very bad fat that is maybe
well, we
hiding
do.
in
That's right. We said that in the book. I mean, we're actually, that's what we seem to have shown in our studies. We're actually doing a more detailed piece of work, really examining that closely at the moment, which is funded by the Genesis charity here. And this is a study, we've nearly finished it, but I don't know what it's shown yet because we haven't analysed it. But we're looking at whether the 2-day diet can preferentially burn fat that you store around your middle, or fat that particularly you store in the liver. Your liver's not supposed to have fat in it, but as we get heavier, we get fatty livers, and that really messes up our metabolism, because your liver's sort of like headquarters really, where it processes food, and if your liver gets fatty, it doesn't work very well. So the study is women are randomised to follow either a daily diet or a 2-day diet, and we're looking at the effects on their liver fat and their fat around their abdomens, and we're also looking at their metabolic rate, because one of the things that happens when you diet to lose weight is that your metabolism slows down, and that's when your weight loss slows down. And that's when everything kind of grinds to a halt, and then people think, oh, I've had enough now. So we think that, we don't know, but we're hoping that the 2-day diet might have a less of a reduction in your metabolic rate, which would be great. So we'll probably be able to publish those findings sort of beginning of next year once we've analyse them, so that'll be very interesting too.
Since you mentioned that, of course we know that there are problems in funding research at all levels, from philosophy to every department. But so who funds your research?
Yeah, it's a challenge, because we're trying to develop diet interventions that you can't really market. We're not developing a drug that a pharmaceutical company can make a profit out of, or even a sort of nutritional supplement that you might be able to benefit from. So it's always a challenge, and we generally in the UK we go to either our National Health Service that funds some patient research, or we go to some of the, particularly we're interested in cancer, so we go to some of the cancer charities. We've actually benefited. You're in this beautiful building here, the Genesis Breast Cancer Prevention Centre, and the Genesis charity is a local Manchester-based charity that basically raised money for this building and have funded a lot of our research over the last sort of 15 years really. So they do fund a lot of the dietary research, and in fact put a lot of money into the studies which led to the 2-day diet book. But
so since it is a struggle also for you, what keeps the fire burning then and going further?
Yeah, well you do. I mean, as a researcher, I don't know if people realise it, but you probably write about 10 applications and get one successful grant, which would be fine if you wrote a grant application in a day, but these are sort of weeks of work really. So there's a lot of work that goes, you know, behind every successful grant and research paper that people see. There's been a lot of work and heartache, but I guess generally every time you do something, you're building your ideas, you're consolidating your thinking, you're finding new people to network with, and you're refining it and improving it. I think it's a hard system, but I think if people just gave you money for, you know, if you just had an idea like on Sunday night and you came into work Monday and you were given money, I think our research wouldn't be so good. I think the fact that you have to has to be competitive, you have to really think about it, refine it, so work with other people, then obviously get through all the ethics committees and things here, which always flag up a series of questions and issues that perhaps you hadn't thought of. I think generally things get better for it, and certainly I think we've developed our ideas over the years. So I think you've just got to stick with it, and that was I don't know how you get that tenacity. I think that's something you either have or not, but you need it for research. That is for definite.
But then very important in this case, there are in research or in clinical
Yeah.
publication, there are not so many bestsellers, but the book you wrote is a bestseller,
Yeah,
The Two-Day Diet, quick and easy, and this is hit here, and this book is so successful. I want to point this out, that there are lots of other people that try to profit too, but the difference is that your proceeds go to breast cancer research.
Yes.
This is a huge difference. It's not profit. It's not for profit.
Yes. Yeah.
Why is that?
Yeah. Well, it's interesting. I mean, we've got the Two-Day Diet book, which actually came out about 2 years ago now, and it's in about 20 different languages, including Germany, I believe, and certainly Italy as well. And it's actually in a lot of Asian countries. And it's quite interesting. People were really excited about our research findings with the Two-Day Diet, and I was presenting them at San Antonio in 2011. And I remember I was there at the conference, and I was being emailed by a lot of publishing houses saying, this is really interesting, you know, we have to write a book with you. And I was thinking, I haven't got time to write a book. I've got so many research findings I need to write up. I need to keep my team going. I need to get grants in, as we said, write those 10 grants to get that one application. I don't have time to write a book. And also I was very wary about getting into the diet industry, because the diet industry hasn't got a great reputation. It's a bit, it's not usually evidence-based. There are very few diet books that you can get off the shelf in a bookshop that have been actually researched properly. They're people's ideas often, or people's experience that they put in a book. And so I was very wary about getting into all of that, and I thought perhaps that scientifically I might be compromising myself by writing a book. But anyway, we decided to do it for a number of reasons. Yes, one is to raise funds, very valuable funds, for the breast cancer research, and not for personal gain, and that's really important, and I would never have done it for personal gain. But the other reason we did it actually is because we want to make people healthy, and we want to get a message out there. And actually, you know, I can get stuff published. I could get stuff published in the Lancet or the British Medical Journal, and some of my peers would read it. It might get into the national papers as a little splash, but it wouldn't really help the people out there change what they're doing. Whereas if we wrote a book that was accessible for people to follow, then we could get the message out there. And in fact, we've sold 300,000 copies, so the message has got out there to at least 300,000 people, but I guess they've passed the message on to others as well. So that was our motivation, is to actually use it as a way of really communicating directly with the people that need to know. So yeah, seems to have worked.
Yeah, this is great.
Yeah.
But about if you think about all the imitation, I don't know if you see them.
Yeah.
Is there something that could be dangerous instead of?
Yeah. So of course, what people have done is taken our research findings and adapted it and really simplified it, of course, to make a very appealing story. So a lot of the other 2-day or 5-2 diet books, intermittent fasting books that you will see, are really telling people just to have 500 or 600 calories a day for 2 days a week, and then eat whatever you want for the other days. And I have a number of problems with that. One is that that's never ever been researched, and they quote a lot of our research to back up those books, which of course isn't quite right. Having just 500 calories a day of any food won't necessarily be easy for people to do. They'll probably be hungry. They're probably not getting all the vital nutrients that they need. In fact, some of the books have little tables in the back. You can make up your 500 calories from sweets and alcohol if you want to. Okay, and I tell you, you'd be damn hungry if you did that. So our diet has been rigorously it's been designed by myself as a dietitian, and been tested, and we know that it's got the essential nutrients in it, and we know that it doesn't make you lose sort of muscle mass when you follow it, etc. And so, yes, so the other diets talk about 500 or 600 calories. And then on the other days, of course, they say you can eat whatever rubbish you want, which, of course, it's just not going to work. I mean, I think what actually happens is that people tend to eat less on the other days. But a lot of those books have pictures of, you know, fruit and vegetables on one side and then burgers and ice cream on the other side. So it's giving a wrong message. But of course, it's a message people think, oh, that sounds great. You know, I can still eat all the rubbish and junk food and be healthy. But it doesn't work like that.
Yeah, as long as I care.
Yeah.
I reduce for 2 days. I can.
Yeah, because it's better than having junk food 7 days a week. But it's not really the optimum.
It's not enough.
Yeah, yeah.
But if we go back on the subject of fire, you know, the other question was about what keeps the fire burning.
Yeah.
Now we stay on the fire properly. So do you enjoy cooking?
Yeah. I don't have that much time to do it because I tend to get home from work quite late and then want to kind of like pick up with stuff when I get home. But I do, yeah. And I do tend to cook healthily, and I've done a lot of the recipes out of the book actually. I'm not very good at following recipes actually. I tend to kind of do my own thing.
Where did you get the recipes
So
from?
the recipes were actually developed by a chef that we had who we basically fed, you know, told her which foods she could include and not, and then obviously we kind of worked with her to develop things that she could do. So, but yeah, so a lot of the ideas came from the chef, which is great.
Okay. So now first we have to be a bit. That we have to be a bit quick now to the end, and so this leads me to the next question: how rapid are the results when you start doing the diet that you suggest?
So, I mean, weight loss obviously happens, you know, pretty much straight away. You can probably lose, you know, a couple of pounds a week. But in terms of, you can actually start improving probably your metabolism, you know, even after a couple of days of doing the diet, things start normalising. You know, you get these rapid improvements, and obviously but you've got to keep the weight up because you actually get rapid improvements, but you get rapid, you know, reversal if you stop dieting and go back to your old ways. So you have to kind of keep doing it, really.
So it's just a new lifestyle.
Yeah. And for people that get down to a healthy weight, we think that, you know, maybe 1 day a week will be enough to keep the weight down, keep those metabolic benefits going. Yeah.
But you write in your book that eating in that way, you also enjoy food or taste more intensively.
Yeah.
Why is it?
I think because a lot of people don't realise, we eat food without really realising it, and we get in silly habits, and quite often we're eating stuff when we're not really conscious of it. So I think the fact that for 2 days a week you're quite, you know, relatively restricted, you really learn to appreciate food and what your appetite is and what hunger is, and I think that's it. I think it's just really reconnecting you with food, if you like, that perhaps people have lost that connection. So.
But you know, there are then situations like when we travel, and there we are confronted with very poor choice of food. What are you doing in this case?
Yeah, that is a challenge, definitely, when you're away from home, and particularly travelling. I think, you know, airports, and certainly in the UK, if you're driving and you stop at a service station, the food is appalling. So I guess you've got to be a little bit organised and maybe try and, you know, take something with you within reason that you can, you know, snack on, etc. Have plenty of drinks and water and stuff, I guess. But yeah, I'm not sure if we're going to be able to change airport food in the next that quickly.
Maybe we could make some pressure. In that sense.
Yeah. But it is a problem.
So then we can say that you are a health entrepreneur. Do you think research need business skills today too? Because you sell your book, I mean, you are deciding that you don't do it for profit.
Yeah.
But if this would be possible, what do you think about medical entrepreneurship or technical or health entrepreneurship?
Yeah, I guess the thing is with sort of research and nutrition is if you're an entrepreneur, I guess you tend to have an idea and you'll go with it and sort of keep going with it and push it and be perhaps not quite so objective about other things which might come along, which might suggest that your approach isn't the best. So I'm not sure that is a good idea. I think we need to be open to lots of different ideas rather than having one product or one idea that we kind of pursue until, you know, we expire, really. I think that's the problem with research generally. I think we should be, you know, have an idea, research it, modify it. But I think if you have a product that you kind of promote, you know, irrespective of what else is going on, I think that's going to really compromise your position. So I would be quite wary about that. I think you need the drive, but I think it needs to not be, you know, from a financial point of view, really.
Okay, so you had this idea, is your product, and so actually you could start to say, okay, so now I start to sell some diet food or with your brand, and so you could, but you say no, this is the commercial part.
I think that compromises your position, really. And I spend a lot of my time, actually at the moment I've nearly finished a review, I'm just constantly trying to find evidence to either support it or really go against what we've shown. You know, is there anything out there that would suggest it's not safe? You know, we need to do more research, clearly. Nothing's come out yet, but I constantly screen the horizon to see, could we be doing harm? You know, you have to keep asking the question, are we helping people? Are we doing harm? And I think if you have, you know, if you go down the road of doing products, you've kind of assumed it's all great. And I think that's a mistake.
So what kind of challenge would tempt you in the future? So as next, are you refining this, or do you have a more?
So there are things that we need to understand about the diet. We need to understand a lot more about why it is easier for people to do it, in terms of it seems to suppress people's appetite. So I'm actually speaking to a researcher tomorrow to see whether we can perhaps look at some of the mechanisms of why that might be. We need to look about how we can actually try and implement it within our health service. There are lots of different settings, and I'm sure there are in all countries, but certainly in the health service here, where we're always trying to get people to lose weight, that are not very successful. So it's trying to implement it in different health settings with different groups and research that properly. I've already mentioned the mechanistic work that we're doing. We're interested in preventing cancer, and we're actually we are recruiting currently to a trial here which is trying to help ladies with advanced breast cancer to see whether it might help the chemotherapy work well. So I think there are lots of other settings where it may apply, but they all need to be researched within their own setting.
So now I have a very practical question. Is this system or your diet also implemented in your canteen here?
A lot of people do it. A lot of people do it, and a lot of people in the hospital. Again, you talk about airports. Unfortunately, hospitals in the UK, the canteen's food is normally notorious.
Everywhere.
Actually,
universities too.
The cafe we have here is actually a bit better. And I know a lot of people in the unit have been doing the diet successfully, and their partners, and so we have had that effect, which is great.
You have told us so many fascinating things. Now we have to come to an end. But I would like to ask you, what would you like to suggest to people that want to start your diet, or are going to start it today or tomorrow?
Okay, so I think the thing is with our diet is it is doable, it is very simple, but you need to probably think about it a little bit and probably get used to it. So quite a lot of diets, people will start and then they'll give up very easily. With our diet, probably the first time you do it, it might be a bit of a challenge. And then you maybe need to do it for a few weeks, and then it will get easier. And once you get your head around it and used to those 2 days of eating less, they get a lot easier. And so I think you need to stick with it and invest a bit of time, and then you will reconnect with your food. You'll realise what portions are. Our diet does ask you to think about different food groups, you know, not just counting calories, which does require a bit of investment of time. So but it's well worth doing. You know, we've had really good long-term results, so stick with it.
And how can the community support your work? How can we all support your work?
I guess it's passing, you know, the more people that hear about it, the better. Obviously, people can buy the book, but equally people can... I think other people in the research community need to do more research. I mean, people say to me, oh, have you not looked at it in this setting or this setting? And it's like, well, I can only do so much with my grants. So I think my peers, I know there's a lot of interest, so people need to research it in other settings for sure. But I think... But generally, yes, you know, people can pass on the word and try and do the diet, but try and do a diet that's evidence-based rather than one of these crazy 600 calories of sweets and alcohol things, because they're not going to work long term. So
yeah. But now we come to the last question. Since you are closer to the mystery of life as a scientist and as a very committed scientist, what does really matter in life in the end?
I think people need to feel valued and be happy within themselves, whatever they're doing. Have something in their life that is fulfilling. So obviously, for me, I have a very busy life with work. But I think it doesn't matter what people do, as long as they've got some passion and some interest in something. It could be looking at trains, it could be any sort of job really, or any sort of role that people have, you know, obviously, being a parent. But I think as long as people have something in their life that makes them feel, that they're interested in and makes them feel fulfilled, I think that is so important. And I guess that's one of the things that not everybody, unfortunately, seems to have that. And that's, I think, what we should aspire to, for people to have. We don't all need to be very rich and have very high-powered jobs, but we just need something that engages us really.
Okay. So thank you very much, Michelle Harvie, for your time for your work.
Okay.
Thank you.
You're welcome. Thank you.
Thank you.